Now we turn to randomized controlled trials. Now, for pharmaceutical drugs, which have been done since for the last 20 or 30 years, participants are randomized to receive the drug or a placebo. Health outcomes are reported. Risk is determined by comparing outcomes for those treated versus those given a placebo. Note well, a drug trial would not include participants already taking a drug. Suppose a drug manufacturer was to investigate the results of a new statin. Would they enroll participants already taking a statin? Hell no. They would take naive statin takers. They want to compare taking their statin, to somebody taking no statin. However, most vitamin D RCTs ignore the rules that the drug manufacturers use. They enroll people no matter how much vitamin D they have. They then give too little vitamin D. Most people who would volunteer are educated, high-income people who are quite willing to participate over a 5-year study, taking vitamin D or taking placebo. And then they analyze results according to, do they take vitamin D or not, according to the protocol. Now, Robert Heaney, who worked closely with Grassroots Health, published the guidelines for clinical trials for nutrients in 2004. His guidelines, as adapted for vitamin D, are, first of all, a measure 25-hydroxyvitamin D concentrations and only include participants with low values. Dose with sufficient vitamin D3 to raise 25-hydroxyvitamin to achieve health and benefits or improvements. Measure achieved 25-hydroxyvitamin D after a year or two and determine health outcomes. Then analyze the outcomes with respect to achieved 25-hydroxyvitamin D concentrations, not vitamin D doses. Hardly anyone does this. There's one study from Iran where they just compared two groups of pregnant women, 900 in each case, one in a hospital where they were not treated and have average 25-hydroxyvitamin, 11 nanograms per milliliter. The other, they treated them to raise their 25-hydroxyvitamin over 20 nanograms per milliliter. They found very significant reductions in preeclampsia, gestational gestational diabetes, and preterm delivery. But you couldn't even do that study in the United States. First of all, very few people have such low values, and even if they were included in a randomized controlled trial, ethically, it's not considered ethically to not give those in the placebo group at least 400 IU per day. So you're not going to confirm this in the United States.